So let's go back to hormones. So there are different types of hormones. Although there are many different hormones in the human body, they can be divided into 3 classes based on their chemical structure. You can have lipid-derived hormones. What does lipid mean? Fat, so derived from fat. Amino acid-derived hormones like protein, and then peptide hormones. They go on to say, let's talk about lipid-derived hormones. So this is derived from fat. Most lipid hormones are derived from cholesterol. Did we know this? Most lipid hormones are derived from cholesterol, so they are structurally similar to it. The primary class of lipid hormones in humans is the steroid hormones, ketones, and alcohols. Now, their chemical names will end in OL, as in cortisol, or IOL, yeah, for the alcohols, or it might end in ONE. So you'll know something is a hormone by the way it ends. So if it ends in OL or IOL or ONE, it's a lipid-derived hormone. Now, why are lipid-derived hormones so important? Well, they're derived from cholesterol and they're steroid hormones. Now, steroid hormones are hormones that help to build up your body. Yeah? They help to build up your body. That's the reason why they took steroids or steroid hormones and made drugs out of them. That's what steroids are. So if a male wants to take steroids, they're taking it to build themselves up. That's what your hormones in your body do, steroid hormones. Now, cholesterol becomes the star of the show because once you start to understand science, you'll realize cholesterol is the precursor to pregnenolone. Pregnenolone is the precursor to progesterone, and progesterone is the precursor to your steroid hormones, which is estrogen, adrenaline, and testosterone. Yeah? Now, why is this important? Well, they say in the UK that black people have high cholesterol levels. So when we have high cholesterol levels and we go to the doctors say what to us? Take a statin drug, yeah? Statin drugs are designed to block cholesterol. But if you take a medication that blocks this, what happens down here? Hormonal imbalance. So that means if you're on a statin drug, yeah, it might be blocking the high cholesterol, but you'll have a hormonal imbalance. There's no way you can't, because it's blocking the thing that these hormones need, yeah? And not only that, not only is it the precursor to estrogen, adrenaline, and testosterone, cholesterol is the precursor to vitamin D. So, the cholesterol in our skin, when your skin is exposed to the sun, in particular UVB rays, ultraviolet B rays, the cholesterol gets converted to a precursor of vitamin D that has to go through your liver and kidneys, and then your kidneys produce the active form of vitamin D. So that means when it comes to your hormones, especially the hormones that help to build you up, cholesterol's the star of the show. But again, if we don't know this, remember, anything that's outside of your awareness is outside of your control. If you don't know this, when you go to the doctors and they put you on a statin drug, it blocks the star of the show. It's going to block the star of the show. That means hormonal imbalance here, stress levels here, for men, hormonal imbalance here, and for all of us, no vitamin D. No vitamin D. That's how important cholesterol is. To the point where if they really knew us as black people, you know, the experts who are always not sure, if we went to them and said, hey, we got high cholesterol, if they really knew us, they should say to us, go on holiday. Make sure you get out in the sun, and all of that high cholesterol will get converted into vitamin D. But they're not sure. All right, amino acid-derived hormones. The amino acid-derived hormones are relatively small molecules derived from amino acids, tyrosine, and tryptophan. If a hormone is an amino acid-derived hormone, its chemical name will end in INE or IN, like adrenaline. So now you're starting to use language and know when you're looking at a hormone, yeah? And hormones give your cells instructions. That's what hormones do. They give your cells instructions. So these are 2 amino acid-derived hormones: serotonin, look at the ending, IN, and melatonin, so you know they're hormones. These regulate the circadian rhythm, which is your internal bodily clock, to maintain a sense of balance, homeostasis within the body. So, serotonin and melatonin. Now again, I teach this to children. So, one is released during the day and one is released during the night. Which one's which? Melatonin at night. And the way I explain it to the children is melatonin makes you feel mellow. So they'll always remember that now. Melatonin gets released at night, serotonin gets released during the day. And it all affects your circadian rhythm, which is your internal biological clock. In other words, how did we survive without these? Because these tell us the time. Well, we have a natural, internal biological clock that used to tell us what time it is, tell the body what time to release what hormones and that sort of stuff. But we don't go by our natural bodily clock anymore. yeah? And the easiest way to go by this is to go by the sun. When the sun's up, you should be up. When the sun's down, you should be down. Literally, that will keep your hormones in balance. If you don't believe me, ask anyone who has worked night shifts for more than 10 years. Ask them about their health. You can't cheat this stuff. When the sun's up, you should be up. And not just up, you should be out there absorbing it. So you shouldn't be in the office when the sun's up. And then when the sun goes down, you should go down. Yeah? And serotonin gets released during the day, so high alertness, best coordination, all that sort of stuff. So all of these hormones get released at certain times to ensure that you're a healthy person. Now, if they get released at different times, the times that they're not supposed to be getting released, then you'll become unhealthy because you'll have a hormonal imbalance. Now, we just rely on our internal hormones and the sun, we'll be okay, but we don't, do we? In the UK, we rely on medication. So most common cholesterol medication in the UK, and look at the way they're ending in, because they're statin drugs, so these are hormones then. These are hormones, but they're not hormones inside of your body. These are external hormones. So these are drugs that they've created to mimic your hormones. You know they're a hormone because they're ending in IN. If it ends in OL or IN, you know it's a hormone. So all of these things are going to be giving your cells instructions instead of your body giving your cells instructions. Again, that's going to lead to total confusion. Again, going by my analogy, you're at work and someone you don't know is trying to give you orders. Not your line manager, not your boss. Someone comes up to you and says, hey, do this, here's your instructions. Do this right now. You're going to look at that person like, you're not my line manager. I ain't doing that. That's not in my job description. Yeah? So medication is going to cause total confusion in your body. Now, a lot of us are on medication. This was the top 20 drugs dished out most on prescriptions across England and in 2017. Tells you what the drug name is, you might be familiar with some of them, and what it treats, and then how much they sold. Look what they're ending in. IN, INE, OL, OL. So these are hormones there, or they've synthetically made hormones to mimic what your body does, but it wants to give your cells different instructions. So all of this is giving your cells different instructions, yeah? Look at this, metformin. A lot of us are familiar with that because of type 2 diabetes. So that's giving your cells some different instructions, yeah? And all of those instructions are going to create an imbalance here. An imbalance here, a hormonal imbalance, yeah? Now, how would you know that everything's on time with this? Because this is your internal biological clock, where there's a couple things you can do. Obviously, when the sun's up, you're up. When the sun's down, you're down. That's one way of getting more in balance with the universe, getting more in balance with the sun and that sort of stuff. But some other things you should know. So, it says here, in the morning, you should have high testosterone levels. So the body, your testes, releases testosterone early in the morning. Now, every guy in here knew this when they were younger. Yeah. Because you used to wake up saluting. So you know that this is true. You're supposed to wake up with high testosterone levels, yeah? How would you know you have an imbalance then? When you're not. That's a hormonal imbalance. We think that hormonal imbalance is just for women. Nah, men have it as well. But the one thing that messes up our circadian rhythm out of all of it is this, the blue light. So, blue light from our laptops, blue lights from our phones, this synthetic light, because this is not sunlight, it's synthetic light. But it's so powerful, the body thinks it's 12 noon when you're on the laptop at night. Because look, the body's supposed to release melatonin roughly around 9 p.m. But what are we doing at 9 p.m.? We're doing this, yeah? We're on our phones, we're on our laptops. And again, the body's going to think it's 12 noon, so it's going to release 12 noon hormones. So you're going to struggle to get to sleep. That's going to cause confusion, yeah? So, and we're not only doing this, you know, we're supposed to be, you know, releasing melatonin at 9 o'clock or trying to get to bed before 12, but black people, it makes me ask this question, like, are black people the new vampires? Because let's explore this. What do vampires do? Well, they wear shades during the day. They can't take the sun. I've heard black people talking about, oh, it's too hot.
It's too hot.
A couple of years ago, we had a long summer. I heard black people say, oh, no, it's too hot. That's a vampire. That is a vampire. And hold on a second. What else do vampires do? Vampires stay indoors during the day and go out at night. We're turning into vampires. And especially our young children, even when the sun is out, the sun is out, what do our young children do? No, man, man's not hot. They're still dressed like children are still out, sun blazing, man's not hot, you get me? But it's funny, but it's tragic at the same time because their skin needs to be exposed for them to create vitamin D. Because this is the only way your body creates vitamin D. Your skin being exposed to sunlight, and then cholesterol in your skin gets converted into the precursor of vitamin D, which goes through your liver and kidneys, and then your kidneys produce the vitamin D that your body needs. Now, vitamin D is so powerful. It literally protects us from everything, yeah? To the point where I've started to tell children that the D stands for defense. It defends us against pretty much every disease out there, yeah? To the point where, now I'm going out on a limb here because this is not backed up by evidence, this is not backed up by the experts, but I'd go on a limb and say, for black people, vitamin D is your immune system. That is your immune system. So it's not white blood cells, it's vitamin D. If you lack vitamin D, your defense system is down. You're going to suffer from any disease that's out there. But if your vitamin D is high, that is your defense system, yeah? Because I've done so much research on vitamin D, I'm like, wow, this vitamin is amazing. It does so many things, to the point where I started to ask the logical question, is vitamin D really a vitamin? If you type vitamin D into Google, it will say this: vitamin D is a group of fat-soluble steroids. You now know steroids are hormones. So vitamin D is a hormone. I did more research on it, and I found this guy. His name is Professor Walter Stumpf. So you can do your own research. Professor Walter Stumpf from the University of North Carolina. Now in 2012, he wrote a paper and published it, a scientific paper about vitamin D. And in the paper, he reports that vitamin D is a hormone of reproduction and fertility. That means if you're lacking vitamin D, you're going to have problems in reproduction and fertility. He says it's a hormone of growth and development. He says it's a hormone of immune and stress response. So if you're lacking in vitamin D, you're going to have issues with stress and immunity. He says it's a hormone of the digestive system. So if you're lacking in vitamin D, guess what you're going to have problems with? Digestion. He says it's a hormone of the central nervous system. And he also says it's a hormone of endocrine regulation. Now this one is powerful because the endocrine system is the system that releases hormones. So if vitamin D is the hormone of endocrine regulation, it regulates all your other hormones. So that means that vitamin D becomes the most important hormone for your body because it regulates all the others. They all rely on vitamin D. So for me, vitamin D is your immune system. It's not white blood cells. Walter Stumpf. Stumpf. S-T-U-M-P-F. Walter Stumpf. So this is what vitamin D does. Again, they're not telling us this stuff. And for those who think, let me take vitamin D supplements then because, we're not going to get any sunlight over here. Well, look at this. This shows you, this is from Dr. John Cannell from the Vitamin D Council. Where can you get vitamin D from? UVB exposure. Look how many units you get compared to what they tell us to get vitamin D from, which is fortified foods and supplements. Hardly any vitamin D, hardly any, but UVB exposure, lots, yeah? So there's only one way. Until they can put the sun in a capsule and sell that to us, there's only one way you can get vitamin D, and that's with your skin exposed to the sun, your skin absorbing it, and it converting cholesterol into vitamin D. So it's UVB radiation, hits your skin has to be exposed to the sun, and then it converts the cholesterol into a precursor that goes through your liver and kidneys, and then your kidneys produce the active form of vitamin D. So again, if you want to quote someone, you can quote me. Leo Marshall says that this is our immune system. Vitamin D, active vitamin D is our immune system. You got that working and everything's fine. It's going to protect you from a lot of diseases. Now, that means that your liver and kidneys become very important to your health because they're the ones that are involved in vitamin D synthesis. Now, what's interesting is a healthy liver and kidneys looks like this, yeah? Because your kidneys are connected to your bladder and then prostate and your urethra. But unhealthy, there'll be a buildup of toxins. And guess where that buildup of toxins goes? So for men, your liver and kidneys being unhealthy might lead to an enlarged prostate. And this is due to lack of vitamin D, because these two organs are the ones that synthesize vitamin D. So if you've got an unhealthy liver from drinking or whatever, and then unhealthy kidneys, it might lead to prostate cancer. So this is what we need to understand about ourselves. Black men in the UK are 3 times more likely to die from prostate cancer or to develop it. Why? Lack of vitamin D. All right, let's talk about inflammation, because anything that's confusing in the body will lead to conflict, and conflict leads to pain. Pain in your body is inflammation. Now, we've all heard about inflammation, but I think that sometimes visuals work better. So this is what inflammation is. Inflammation is the first response to any damage that your body receives, whether it's external or internal. So the damage here is like a pin going through your skin, and there might be bacteria from that damage. And anytime something foreign enters your body, these chemical alarm signals get let off, and then white blood cells come and eat the bacteria or kill the bacteria or kill the infection, yeah? So inflammation is something that your body has to do, because that's the only way that you heal from something, yeah? So something happens, you're damaged, then the chemical alarm signals get sent out, the white blood cells come, which they usually say is our immune system, but the white blood cells come and then they eat or kill the bacteria or the foreign invader, and then hopefully your body can heal, yeah? So the white blood cells, they do have a role. So there's no getting away from inflammation. Anytime you damage yourself, internally or externally, you're gonna have inflammation. But there's 2 different types. There's chronic inflammation and acute inflammation. Acute inflammation is when you damage yourself and white blood cells come to the area, they do their job, and then they leave, yeah? So white blood cells come into the area, there's damage somewhere, they come and they clean up the damage, or they get rid of the infection or the bacteria, and then they leave, and then your cell's back to normal. However, chronic inflammation is when white blood cells come into the area and stay and take over the area. Literally take over the area. So they might come into a tissue or organ and take over the area. And when they're killing bacteria and infections, they release these chemical like bullets that are called histamine. Now, anyone who knows about antihistamines, yeah, histamine is very irritating to the human body. So these white blood cells release histamine, and it irritates the human body. So if you suffer from eczema or asthma or hay fever, any irritating sort of symptoms like that, that's because white blood cells are releasing too much histamine, yeah? And the histamine damages the cell membrane wall. So then when the wall is damaged, your defense system is open, more things can come in. More white blood cells can come in, and then they literally take over the area. Now again, I study history, again, big up Robin Walker, my black history teacher. So when I was studying this, I started to think to myself, right, this looks kind of familiar. So you're telling me white blood cells come to an area and they say, hey, do you need any help? No, we're here to help. Do you need any help? Okay. You want us to get rid of that person? Pow! Well, you want that person? Pow! Okay, cool. And then they take over. So in other words, they'll be like, okay, do you need any help in this country? Yeah, we need that. Get rid of that. Get rid of that. Okay, we got rid of that person. Get rid of that person. Okay, thanks. Go away now. It's a nice country we got here. Yeah, and then all of a sudden, they take over. I started to think, wait, are white blood cells colonizing? That's what they do inside of your body. They colonize your tissues and organs. Now, how would you know if you're suffering from acute inflammation or chronic inflammation? Well, chronic inflammation is chronic, which means you're in pain. So, if you've been in pain or are in pain now, some of us have, back pain, neck pain, ankle pain, understand that that's white blood cells colonizing an area. So if you've got lower back pain and you've had it for years, that's the white blood cells colonizing that area. They've taken over. In other words, they're looking at the red blood cells like, get out of here. It's my area now. Yep. How do you get rid of them? You gotta fight. You gotta fight them. Yeah, we have to uncolonize. So first of all, we have to just have knowledge of self. So we have to have knowledge of what's going on. Because again, going back to what I said at the beginning, anything that is outside of your awareness is outside of your control. So first we need to build up our awareness. So this is what white blood cells do. They're linked to pretty much everything. So anytime you see itis at the end of something, that's inflammation. So now you know that's to do with white blood cells. So arthritis, any redness, swelling, muscle soreness, chronic bronchitis, all of the itises, they're to do with inflammation. Now, what conditions are linked to chronic inflammation? Inflammation is implicated in cardiovascular disease. Cancers cannot grow without inflammation. Autoimmune diseases are due to inflammation and joint pain. So they're all to do with chronic inflammation, yeah? Including fibroids. Fibroids starts off as inflammation. Now, I'm going to show you a clip here. This is from the Breakfast Club. This lady here, she has a very powerful story with regards to fibroids. Have you seen it? Very powerful story. Her name is Coach Jessie. Now, when I watched this, I was looking at these two brothers, and I was thinking they were just going to be Americans. When you hear them speak, they're from the UK, but they're doctors. So this is powerful what they're saying on the Breakfast Club. Listen to this. Her name is Coach Jessie if you want to see the full clip, but listen to her story.
Because of your battle that you've been very open about with fibroids.
Yes.
So explain what fibroids is.
Sure. So fibroids are smooth muscle tumors that are usually benign, and they actually are in and around the uterus. And sometimes they cause infertility. And me, as I said, I was one of those 90% of Black women. In 2016, last January, we launched a program called the Hope Beyond Fibroids Elimination Program. And, we're actually coming up, what, now 2 years? Yeah. And we started just kind of looking at our case history, and we were seeing that not only were our clients living now fibroids free, one patient eliminated 50 fibroids without surgery. And for Black women, they usually send us a hysterectomy.
Right.
Yeah. Straight off the bat. Okay, which I think is a way of neutering us. And then on top of that, they were living cramp-free. Mm-hmm. How many women can say that they're cramp-free? Y'all would like us to be cramp-free.
Some people tell you don't have to get fibroids removed if it's not blocking anything.
Well.
See, that's a lie. That's a
lie.
What they do is when you have small fibroids, they're gonna say to you, let's just
don't
monitor
bother
them.
it.
We're just gonna monitor them, and then it gets to the point where now you need to go and spend some real money.
Right. It gets the fibroids get big. They start messing with your kidneys, your liver, other organs.
Because it's friendly fire.
Right.
It's an indicator because of the root cause. The root cause is estrogen dominance, which leads to other diseases such as diabetes, heart disease, cancer, which are all inflammatory diseases. So the fibroids are indicating that something's very wrong in your body.
So when guys have fibroids, they got too much estrogen?
Well, no,
prostate cancer.
We got prostate cancer.
All right, so they talked about estrogen dominance. Estrogen, estrogen, same thing. So when it comes to estrogen or estrogen dominance, for women, you go through stages, yeah? So I know in the live stream they were talking about menopause and that sort of stuff. Again, our hormones are based on vitamin D and the sun and that sort of stuff. So if we're not getting vitamin D, it's going to create a hormonal imbalance. And then on top of that, if we're eating high estrogen foods, it's going to create a huge hormonal imbalance. But remember what I said, estrogen is a steroid hormone. So it helps to grow things. It helps to build things up. So estrogen during puberty helps to grow your body, woman. It helps to give you your shape, your lady parts. They grow because of estrogen, yeah? And it grows during pregnancy to help grow the fetus. So estrogen levels will be high during certain times of pregnancy to help grow the fetus. So estrogen is needed in your body because it's going to help grow things. However, if you have an estrogen dominance, it's going to help grow other things as well. So if you have a tiny tumor, that will grow. If you have a tiny fibroid, that will grow. If you have some tiny bacteria, that will grow because that's what estrogen does. It helps things to grow. So estrogen dominance will lead to things growing in your body like a cancer cell or a tumor or a fibroid and that sort of stuff. So, and then obviously estrogen is going to be high during your childbearing years and then start to lock off because the body's like, we don't need these instructions anymore. So that's when you start to go through the menopause. Now, menopause is just going through decades of hormonal imbalance, and then the body not having estrogen, and then all of a sudden it's like a shock to the body. That's basically what menopause is. It's like the shock of going through all of this hormonal imbalance, yeah? But like I say, estrogen helps to grow things, especially during puberty and that sort of stuff. It gives you your shape. So black women, this is the reason why you have your shape, is due to estrogen. Now, if this is true, then naturally, who would have the highest estrogen levels? Black women. Naturally would have higher estrogen levels. Now, if someone knew this, the easiest way then to get you sick is to feed you more estrogen. Because you already naturally have high estrogen levels. Why? Because of childbearing. Yeah? So if you have naturally high estrogen levels, we give you more estrogen, it's going to create a hormonal imbalance, you're going to be sick. Now, if you don't believe me that this is our natural shape, who remembers this again, but going back to history? Who's this? Sarah Bartman. Yeah? And so they've been studying you, black woman, for a very long time. Literally studying you. She was studied. They put her in a zoo. They put her in a zoo and allowed people to poke at her and pinch her and do all this sort of stuff. Again, don't believe a word I say. We've all got smartphones. Make your phone smart. Do some research on, there's a movie of her, yeah? So, but here's what's interesting. Look at her shape, yeah? And they were marveled by her shape to the point where they treated her like an animal, right? And then she was sexually abused as well. I think she died at a very young age, like 20 years old, from infection, from sexual diseases and that sort of stuff, yeah? So they used to ridicule her. Look at this animal, look at this person, yeah? And you know what's funny? Who's this? Kim Kardashian. How does she make her money? Imitating her. So she makes her money from imitating her. So how can we make sure that black women stay sick? Let's make sure that they have high estrogen. Naturally, they already have high estrogen levels. Let's make sure that everything around them has high estrogen as well. So what foods are high in estrogen? Most common foods found to be high in estrogen are wheat, including wheat products. So that's your bread and your pasta and all that sort of stuff. What else? Soy. That means your soybeans, your soy milk, your soy products. Soy is just high in estrogen. So all the people that think, oh yeah, no, I'm healthy, now I'm vegan. Most of the vegan products are made from soy. So that's why sometimes I don't like, people ask me, am I vegan? I'm like, I'm not a vegan, because there's confusion there. A vegan will think that they're healthy and they're eating a lot of soy products. It's high in estrogen, yeah? Meat and dairy. Don't get angry with me, it's science. Not according to Leo Marshall, according to science. Meat and dairy is high in estrogen. Why? Well, because the animals, they have estrogen. So, and then they're gonna inject them with more to make sure that everyone has a hormonal imbalance. Alcohol. Tap and bottled water. Tap and bottled water as well. All these all act as endocrine disruptors. Now, Sal, who was talking about the hair, she talked about endocrine disruptors being in hair products. So it's not just in hair products, it's in food as well. Yeah? And for the people who, you know, they think they're healthy just having vegan burgers and all this sort of stuff, which is all the craze now, check this out. This is the Impossible Whopper. Yeah? Now, this is in America. Now, look who they're trying to target. Look who they're targeting, for those who have their eyes open. Yeah. You know, I'll cheer them. Yeah? Look who they're trying to target with this Impossible Whopper, which is a vegan burger. Yeah? And check this out. Doctor, Burger King's Impossible Burger has 18 million times more estrogen than regular Whopper. So all of these, and it's happening over here as well. I think McDonald's have one, Burger King, KFC, they all have these vegan burgers now. Estrogen burgers. That's what you're eating. Estrogen burgers. Yeah? And it's not just estrogen, it's xenoestrogen as well. This is synthetic estrogen that, again, Sal talked about in your hair products, in pesticides, tap water, canned foods, plastics, yeah, and beauty products. Again, don't get angry with me, this is science, yeah? Beauty products are high in estrogen. So if you're using a lot of makeup, that's another way of them getting estrogen in your body, yeah? All of your beauty products that you're using, high in estrogen. And again, it's the estrogen that leads to your fibroids. The high estrogen leads to the tiny fibroid growing to be as big as a grapefruit or even bigger like a watermelon or something like that. Yeah? So going back to the doctors, listen to what they say about estrogen here. And they talk about the contraceptive pill as well. Listen to this.
Cycle. They'll put young girls onto the contraceptive pill.
To regulate
their cycle. They'll say, you know, some girl, and this is the thing, a lot of black girls are like athletes. You might be in the cheerleader, whatever. When women are at the athletic, you know, optimum of athleticism, they don't bleed. You ain't gonna bleed. That's the ones, yeah. Women are supposed to bleed. You're not supposed to menstruate. You're supposed to spot.
Y'all hearing this?
Right?
Like, we're not supposed to have a heavy
It's because of
See, I know you didn't hear it.
estrogen. Why women bleed how they bleed. They're not supposed to bleed.
Medically, we're supposed to bleed only like 3 tablespoons. Now, do you even know a woman? Not even that. It's like spotting.
Unless you're on the,
My wife,
Right, because
She's always pregnant.
unless you're on the pill.
now she's always pregnant, but before that she rarely bleeds. She doesn't get cramps. She doesn't.
Right, and that's good. That's how it's supposed to be. Now, this is the thing. So when girls are not bleeding regularly, something's got to be wrong. So, because something's wrong, let's give you the estrogen pill. Because the contraceptive pill is estrogen.
Right.
So when you take the estrogen pill, now you've got estrogen flowing through your blood and it starts affecting organs. Now, estrogen is a DNA disruptor.
Now, here's the deal.
It's a
Let's stop
cellular
a second.
disruptor.
'Cause we've been taught that estrogen is the female hormone. So understand what he's saying right now is estrogen is not the natural female hormone. It's actually
Progesterone.
You're blowing my mind, bro. You're blowing my mind
That's the
right
big
now.
deal right here.
So this is the thing. So estrogen is free flowing around the body, right? And it disrupts the endocrine. It's an endocrine disruptor. It's a cellular disruptor. It slows down the mitochondria. Mitochondria in a cell. I don't want to get too technical, right?
Don't get the science out.
Mitochondria is the engine and the life. It's the vibrancy of the cell. So when your mitochondria is operating at its best, you don't get sick. You will not get sick. It keeps your cell pure or charged. So when the estrogen hits the cell, it diffuses into the cellular membrane and gets into the mitochondria, slows it down. When it slows it down, now your cell is not charged. Now white blood cells see the cell as foreign. So white blood cells now start attacking, shooting out all kinds of chemicals, and then that's how fibroids are formed. It's the fight between
And it's not just fibroids, it's all kind of tumor. Again, it's inflammatory diseases.
So I'm hoping people are starting to put 2 and 2 together. So white blood cells have a role because they lead to chronic inflammation, and then it's the inflammation which might be small, and then the estrogen helps that to grow. Yeah? And black women, you naturally have high estrogen levels, hence your shape, and hence the fact that you've got wider hips for childbearing activities and that sort of stuff. But if someone knew this, then they'd know how to disrupt your hormones. Just give you more estrogen. Yeah? Alright, now I'm showing you exactly where I'm getting my research from, so you can do your own research. But this is from the US Department of Health and Human Services. Now it says, what are the risk factors for uterine fibroids? So this is America. What are the risk factors for uterine fibroids? So let's see what they say. It says fibroids usually grow in women of childbearing age, and research suggests that they may shrink after menopause because the body gets rid of the estrogen is not needed anymore. Yeah? However, research also shows that they are more likely to shrink in postmenopausal white women than in postmenopausal black women. Why? For African American women, fibroids typically develop at a younger age, grow larger, and cause more severe symptoms. Again, why? Several factors may affect a woman's risk for having uterine fibroids, including the following. Age. Older women at a higher risk than younger women. Interesting. Age. Then African American race. Now this was in America, so they went with African American race, but now we're seeing it's all over the world. So it's not African American race, it's just black women. Yeah? So black women, for some reason, is a risk factor. Obesity, family history, high blood pressure, no history of pregnancy. No history of pregnancy. That's because the estrogen in your body is used for a purpose, to grow the fetus, to grow other things, but to grow the fetus. So if you have no history of pregnancy, that's confusing for your body. So that could lead to fibroids. If that weren't a message from your creator, you need to, the reason why you should be on this planet, like to reproduce. If you don't, you get sick. Vitamin D deficiency, because according to me, vitamin D is your immune system. So if you're deficient in this, you'll start to suffer from that. Food additives and then soy as well. They go on to say other factors include when your menstrual cycle began, obesity, vitamin D deficiency, drinking alcohol, because that's estrogen, diet high in red meat. All right, and then it says there are factors that can lower your risk for fibroids too. For example, research suggests that women who use oral or injectable contraceptives are less likely to get uterine fibroids. Don't believe a word they say though, do your own research. Then those who don't. And the risk continues to decrease the longer the contraceptives are used. Again, don't believe a word they say, do your own research. But check this out, pregnancy also seems to have a protective effect. So again, if you're using your body for what you're supposed to be using it for, you'll be healthy. The risk of uterine fibroids goes down with each full-term pregnancy. Now, according to the evidence, black women, you don't have a problem getting pregnant or delivering a baby, according to the evidence. However, according to the evidence, other people do. Now, what would that be down to? Now you know the science behind it. Let me show you what happens inside of your body, you know, when you're trying to get pregnant.
Sperm are foreign to a woman's body and are treated as unwanted invaders. Her immune system is triggered to kill them. Once they enter the cervix, they are in a labyrinth of dead ends. Perfect for an ambush. White blood cells attack the sperm from all directions.
Like a horror movie. So this is what they're trying to tell us is our immune system, white blood cells. But that's what they do. They attack a foreign invaders and that sort of stuff. So that could lead to infertility. If you have too many white blood cells doing that, it could lead to infertility. Now, I got this clip from this site here. Well, this was on Twitter. They're called medical shots. Now listen to how they explain the video. Immune system attacking men's sperms inside women's bodies leading to infertility. Amazing video. What? What's amazing about infertility? Now, if you do your research, again, don't believe a word I say, do your own research. If you do your research, you'll actually find that white people generally have higher white blood cell count. And black people generally, especially African people, have generally low. So this was taken from, if you want to take a picture of it, Bain et al. So this was an experiment from 1996. So what does table 3 show? It shows Caucasian, African, Afro-Caribbean, and Jamaican. And just look at that top. Men, white blood cell count, WBC count. Who's got the highest? Caucasian, 5.7. Who's got the lowest? African, 4.5. So naturally, African people have a lower white blood cell count. Why? Because according to me, white blood cells are not your immune system. Vitamin D is. So if you're out in Africa, if you're out in the sun, you don't need white blood cells. You need more vitamin D. However, if you're not and you're from a different climate, you might need more white blood cells, yeah? So naturally, Caucasians have higher white blood cell, which could, in them, lead to fertility. According to who? Well, according to the evidence. This came out last year. USA Today, why the US birth rate hitting a 32-year low could become a big problem. Now, this came out in May 2019, but you know it's actually the same over here. So people are having problems with fertility over here. Now, here's why you have to understand language. When it comes to science, I feel like if you understand the language, you'll really understand what people are actually saying when they're talking. So if you just read through this, I've underlined a few things, but it says the birth rate in the US hit a 32-year low last year as the number of babies born dropped for the 4th straight year, federal health officials said in a report. Then it goes on to say the total fertility rate in the US dropped 2% since last year and hit a record low of 1.7 births per woman. Meaning, not enough babies are being born to replace the current population levels. Someone translate that for me. Not enough white babies are being born. The total fertility rate in 2018, they talk about the total fertility rate, and then they say having fertility rates lower than replacement levels means that the country's population could become unbalanced. And then they said, what are the reasons for this? Climate effect. More women say climate change means they won't have kids, and then the experts are saying couples are having less sex. Okay. They're just trying to explain this, yeah? Now, when this came out, again, May 2019, when this came out, laws changed straight away in the US. Look at this. Alabama just passed a near total ban of abortion, no exceptions for rape or incest. Doctors could face 99 years in prison for providing abortions. And then this woman says it's a war on women. It's a war on women and it's time to fight like hell. All right. And other people started to go with this. So look at this. This guy from Twitter said 22 senators voted against including an exception for rape or incest in Alabama's new draconian abortion law. And these are the people that said, hey, listen, I don't care how you got pregnant, you got to have that baby. Yeah? Because we don't want the population to become, you know, imbalanced. They're at 3%, how dare them get to 4%? Yeah? Look at this. Again, this is America. Passed new abortion limits in 2019. So these are the states that have passed this abortion limit. In other words, you can't have an abortion even if you were raped or whatever. Yeah? So how many is that? 1, 2, 8. 8 states in America. That was 2019. What's that going to look like by 2020? Or 2021? Or 2022? Yeah? And again, people will say, well, that's America. You know, in America it's blatant. Well, over here, actually, if it was over here, you tell me. Because again, in America, the state of the water is obvious. If over here we had an issue with race, yeah? What area of the UK would have the highest abortion rate? London. More abortions carried out in London than anywhere else in England. Yeah, so this was from 2016. 2016, and it says abortion rates are higher in the capital than anywhere else in England. London boroughs comprise 9 of the top 10. And if you want to know the boroughs, they're there. So, oh, some of your boroughs might be in there. Yes, so some of your boroughs are in there. So, again, we like to play the I don't see game over here, but evidence is clear. Now, why is this happening? Why is there so many abortions in that area? Yes, bro. This one. So why is this happening? And why in London then?